what about the strategy of testing? I mean, yes, you have to test quite a lot.
Yeah.
But is there a particular method to testing? What are there certain areas that we test? How do we think about testing as a strategy?
Yeah. So people, by the way, there's nobody I would say, well, actually, I shouldn't say nobody. South Korea, Taiwan, Hong Kong, the East Asian countries have actually done a very, very good job of this. But certainly in Western Europe, United States, people are still trying to come up with what is the right testing strategy. My general approach on this has been, you have to have, so let's kind of talk in generic terms and then maybe customize it a little bit for India. So in generic terms, you should be testing anybody with any kind of symptoms. You won't pick up everyone because there are a lot of people without symptoms. We think, probably 20% of people have no symptoms throughout their entire disease, and another 25% of people spread the virus before they develop symptoms, but they will eventually develop symptoms. So you should be testing everybody with symptoms. And then you should have a strategy for surveillance of high-risk areas. And so you have to sort of think about what are high-risk areas, and that's where you really have to customize it. To individual things. So, we talk at least here a lot about homes for elderly people or hospitals. My feeling is anybody who gets admitted to a hospital for almost any reason in an area with any kind of an outbreak should be getting tested. Mostly because if you miss an asymptomatic person, let's say who comes in with a heart attack, or let's say comes in with a broken leg, but they're asymptomatic and spreading, they could spread it to 30 healthcare workers and 70 patients, and that would be a disaster, right? So you need a very aggressive testing strategy in high-risk areas like hospitals, like homes for elderly people, et cetera. And then, if you can, you want to be doing more community-level surveillance just to make sure that you're not missing undetected disease. So it's really a combination of all of that, and it depends on how much testing capacity you have.